Okay, well, welcome. This is Brian Hagan from Purposeful Foam Rolling, and I want to talk about a muscle that can cause a little bit of pain right between your shoulder blades. And this is some people know this muscle, some people may not know this muscle, but it's called the rhomboids. And there's a small rhomboid and a large rhomboid, a minimus and medius, I guess, or major minor. Sorry, major minor. But we're just going to talk about it as a whole muscle. So this muscle. Again, creates pain pretty much right between the shoulder blades. And where this muscle is located is obviously right between the shoulder blades. It sits right here. So between this big bone here called the scapula, the shoulder blade, and this one right there, where this is all in orange, this is the rhomboids. And they basically start up here right where the spine of the neck ends, right there. We call that C7. And it comes down and attaches on the upper back spinal cord. T5 is the actual part, but that's the location of it. So really, if it's right between the whole bone of the shoulder blade. So if you take your hand back here and you find your shoulder blade right there, and you feel that back there, that's anywhere along that bone, right in this area, you're going to be on that rhomboid muscle. And if you put your hands back there and then sort of pull your shoulder blades back, you'll feel it move. You'll feel that muscle work. That's the rhomboids. Okay, so why is this muscle so important? Well, it's chronically lengthened because of the way we tend to sit, working on computers, looking at our cell phones, tablets. So what happens is that this muscle in the front, our chest muscle, is so big and powerful, and if we stay in this position, it's going to want to keep us in this position. Well, guess who gets angry and gets pulled and torqued around when we're in this kind of position, this rounded shoulder position? It's going to be your rhomboids, because you notice this gets shortened. Well, that gets lengthened. And when that's lengthened, it gets angry. So it can develop these things called trigger points or hyper-irritated points. They fire off pain. And this muscle has three areas that are very typical trigger points. They tend to get they can develop trigger points in these three areas. So how do we well, first of all, let's show you where the pain is on this, and then we'll show you how to take care of it, okay? Let me step back. What does this muscle do? Well, the main job of this muscle is to pull your shoulder blades backwards. So instead of doing this, its job is to do that. Its job is to pull your shoulder blades backwards. But it also rotates the shoulder blade, or it rotates it medially. So it's turning it this way, pulling it inward, and that causes your shoulder blade to drop. So if you're up like this and you lower your shoulder blades, the rhomboids are doing that. Okay, so when I pull this down, it's one of the muscles that's doing that. But as I pull this down, that shoulder blade rotates and it brings my shoulder blades down. Okay, so again, what do we do all day? We're this and we're this, and so that puts this muscle under a lot of duress. And when it gets angry, where does the pain show up? It shows up right in here and right in here on both sides. Both sides. But I don't know if you can see that. Let's draw that a little bit darker. There we go. This whole area here can have pain, and right up in there can have pain. Now, typically, the pain doesn't show up when we're using the muscle, not normally, unless it's really aggravated. It's usually when we're trying to rest and you get this aching, throbby pain. That would be this muscle, and it's deep. Sometimes people will tell me I have this pain under the shoulder blade. I feel like it's under the shoulder blade. And that's because this muscle is sort of attaching on this inside border of the shoulder blade. It's kind of attaching on the underneath side of it. And I think that's where that pain sort of radiates deep underneath the shoulder blade. So how do we take care of that? Well, I think the best way to do that is to take a tennis ball and just work this area out. And you can do that against the wall or on the floor. Let's see if I can show you here. Okay, so I'm going to take my tennis ball, and I can use either two tennis balls and a sock, which is what most people, they like to have one where they have it all together, or you can just use the single one. I'm just going to show the single one here, but I'm going to just work from the very top and just work my way down and try to work right, not on the spine. I don't want to be on the spine, but just along the edge of that spine and along the shoulder blade. And I want to get my feet out about 2 feet away from the wall, so I got some pressure. And I'm just going to drop my butt straight down. Let's see if I can actually show you how to drop that down just a little bit here. Okay. So here I am. I got my feet out, and I'm not pushing my way out toward the camera. I'm just dropping my body straight down. Just like that. And if it's particularly tender, you can rock back and forth. And just what you're trying to do is break out that trigger point, break out the scar tissue and adhesions that are just breaking it, that's making this muscle angry and tight. So you're just working on that. And basically, you just want to work the whole length. Just work that tennis ball in here and try to break up these trigger points and the scar tissue and all the garbage that's in there. And then you want to strengthen it. So any kind of activity that requires you to pull your shoulders back and pull your shoulders down will help this strengthen this muscle. You can do it with exercise bands. You can do it with weights, light weights, wherever you're at. But I mean, you can do back flies, seated rows. Any of those are going to help. And then you want to stretch this out. You want to stretch this out, and you can do that against the door or like this wall here. I've got an edge wall here. I put both arms here and just stretch my arms out that way. That'll help stretch my chest out. And if I work on opening this up, it's going to take the load off of that in the back. Okay, so it's several things that you need to do to get it to be healthy. Tennis ball's here to work it and get it loose, stretching the front and then strengthening the back. Okay, and that should help. This, I know this muscle personally, just from my clients. A lot of my clients had this issue, and then I was dealing with it also. Where I had that kind of achy pain in the back of my shoulder blade, and I just had to get on it with a tennis ball and work it out, and then strengthen my back and loosen up my front, and that took care of it. All right, well, I hope that helps. Have a great day and take care.